Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, along with my producer, Lindsay. We are streaming from downtown Wenatchee, Washington today. We are back in Washington and happy to be there. We are. It's a beautiful day. It's a lovely day, and it is going to be a great day. Um, today I have on our show Dr. Zinia Thomas. She is a psychiatrist that a few years ago went into some alternative treatments for mental health disorders, including the use of ketamine infusions. And we'll talk a little bit about ketamine and cannabis for mental health disorders. As always, you can catch our podcast, our midweek podcast. Usually it is on Thursday, 8 to 9 a.m. We are doing it on Wednesday. And thank you, Dr. Thomas, for being accommodating. We are doing our midweek podcast on Wednesday because I will be out of town the rest of the week. So you can usually tune in on Thursdays, 8 to 9 a.m. and every Monday, 1 to 2 p.m. right here on my personal Facebook page and the Moses Lake Professional Pharmacy YouTube site. For people that don't have Facebook, please go to the Moses Lake Professional Pharmacy's YouTube site, subscribe to it, and comment. Please let us know what topics you'd like to hear. Also on the podcast forums. So SoundCloud, iTunes, Google Play, all those podcast forums. We are available usually a few days after we go live. So you can listen in there and please subscribe, share it, let us know your feedback. Message me on Facebook too. I've got a lot of callers and viewers that message me on Facebook and give some feedback. So we really appreciate it. So Dr. Thomas is in Missouri, and she just let us know that 75 degrees there today. So good for you. That's awesome.
Yes.
We're our weather's been on and off, and I think I don't know. I'm sure it got in the 30s last night. It's cloudy today, so glad you have good weather. So without further ado, Dr. Thomas, I'm going to kind of let you introduce your history of being a psychiatrist, and then how a few years ago you decided to go into some alternative treatments. So I'll give it to you.
Okay, thank you. Thank you so much for having me. Yes, exactly like you said, I trained conventionally in psychiatry, general psychiatry. I did my training in New Jersey, UMDNJ. Then I did my fellowship in child psychiatry at Yale. And then I practiced for about 15 years and did all sorts of things, inpatient, day hospital, IOP, residential treatment, and outpatient treatment. And what you're seeing is just chronic disease, and these pills that we have, the treatments that we have are very marginally effective, 39%, 50% efficacy. And then really the burden of the treatment relies on the clinician, behavioral modification, changing behavior therapies. Yet that is, operator dependent one, and it really takes a lot of effort on the patient. And that may not be possible during a mental health crisis, depression, suicidal thinking, even just a anxiety state or panic state. So, then kind of what do? You go back to the basics. And yes, when people do exercise, sleep, get enough sleep, eat right, they do tend to feel better. And so kind of took that approach, maybe in my practice with pills, but also with sort of supplemental nutrients. There's a genetic defect called MTHFR. I don't know if you heard of that, but it's it's not that common in the general population, maybe about 3% of the general population, but 80 to 90% of the psychiatric population are missing these enzymes. And so that's what I was noticing in my practice. I would do the liver genetic panels to see what medications would be good for people. And they'd all come back with MTHFR, heterozygous or homozygous. And so that's where I thought, well, maybe I could just give folate or B12 and people's serotonin levels or their mood will improve naturally. We don't have these nutrients, so let's give them back to the people. And that people were doing good with some, Deplin, these methylfolate preparations. With Prozac.
So Dr. Thomas, before we get too much further, let's explain what MTHFR is, okay, exactly what it is. And
Yeah.
then we can kind of get into some of the treatments like the Deplin and L-methylfolate
Yes.
like you're talking about.
Right. So, I really didn't know about it either. It just kept coming positive on this panel that I was getting, this genetic panel. And MTHFR is a methyl tetrahydrofolate reductase, and you're missing that enzyme. And some people can miss 1 or 2 copies. And if you're missing that enzyme, you're never really breaking down folate or your vitamins. And if you don't have that end product, methylfolate, you're really not going to go make your neurotransmitters. You can't make serotonin, dopamine, or norepinephrine to any good degree. So they say people with missing 2 copies of that MTHFR are, double trouble. Is really, you're making about to 80% less serotonin than someone who has both of those copies. So obviously much more likely for depression, anxiety states, addiction, those kind of serious mental health issues. And there's various combinations, ADD, anxiety, if you're heterozygous with the A copy, depression, anxiety, if you're homozygous with the C copy. So that's really kind of a basis where you can kind of really get to the biochemistry and what are nutrients that our body needs.
And basically the bottom line is, this is what I tell patients, even if they haven't been tested for MTHFR, it's really easy to get tested.
Mm-hmm.
You should do it. But even if you haven't, I believe in, like if you're taking a B complex, which almost everybody should take some kind of B vitamin.
Mm-hmm.
There's no reason not to take methylcobalamin and L-methylfolate. Make sure your B vitamins have that. They are a little bit more expensive, but it's very, very important you have L-methylfolate and methylcobalamin. So thank you for that educational piece, Dr. Thomas.
Yes. And just kind of learning about the basics, nutrients, methylfolate, omegas, for the brain health. Then that kind of really led into cannabis, cannabinoids. And what was so surprising would be people coming in, and by this time I was into the natural wellness, but people were coming in saying they were able to come off of SSRIs. And in my practice, psychiatric practice, I did try to help people come off of those medicines onto something safer and natural, or just diet. But it would be hard. 20 really slow. These SSRI withdrawals are real and and really hard. But then people would come in reporting they would get off these things in a week with use of CBD. And just over-the-counter CBD, and I was shocked. And so then I kind of got into a little bit more research with that. And the same thing, the people who are interested in cannabinoids really started in fatty acid research and omega-3s and brain health. And same thing, it all goes down to these are nutrients our bodies needs. And when we put that on prohibition, what happens? We become chronically ill. And that endocannabinoid, we're deficient in cannabinoids, and we're off. And that's what people were telling me in my practice too. My mood is off, my sleep is off, my hormones are off, my gut is off, my immune system is off. And then later I realized that is that endocannabinoid system. This is exactly where all those receptors are in our immune system, in our brain, in our skin, in our nervous system. And when we correct those deficiencies, similar to a B12 or a vitamin D deficiencies, we are going to heal, correct depression, bipolar disorders, neurological issues. So, and that is what is amazing that I've started to see, tremendous healing, just legal, and really all you can do with cannabis is give someone the cards. You really have no authority to say, take this TID and, for a month, you can educate, but you can't, there's no way to monitor compliance. And so you really have to just make sure that they're doing that on their own. And so that's what I try to do is what do you need to heal? It's much more than just using THC. It's a combination.
Explain for our viewers and for me, what specifically do you prescribe when you prescribe, either CBD or cannabinoids or cannabis? I mean, is there a specific strain? I know there's a lot of detail that goes into that now. So can you help us with that?
Yeah, sure. Really, I kind of put a disclaimer. There's no data out there. So, really, I can't make those claims. No one can make those claims. There's nothing going to be on the shelf. This is for PTSD, this is for migraines. This just going to be, try this, it's maybe going to help. So I kind of break it down into kind of two parts. You need something, compare apples to apples. When you're swallowing a capsule or an edible, that's going to be close to a pharmaceutical pill. It's going to enter your digestive system. You're going to process it and metabolize it. Even those metabolites are receptor activators. They go into our endocannabinoid system and activate it. So you do want to ingest it. Every edible or capsule maybe lasts about 6 to 8 hours. So I do encourage like TID dosing if you're treating a chronic issue, mental health, pain, gut issues, migraines, pretty much everybody except insomnia. And even insomnia, you need a 8-hour, one edible at least at night. And then with the edible, I try to say, get as many cannabinoids you need in it. And I have a great, cheat sheet, I call it. It's from Israel, Dr. Meshulam, who has done all this research, it's probably about 20 or 30 issues: stress, Alzheimer's, autism, bipolar, pain, and then it tells you what cannabinoids you need. It's almost, I tell my patients, it's a recipe for your health. So you need help for insomnia. You need CBD, THC, CBN, and CBC. And those, they all serve a purpose. They all have a role. CBD decreases inflammation. THC is one kind of that promotes the sleep. CBN repairs the nerve functioning. So using them together, that's what they call the entourage effect. And I say it's easiest to get all those cannabinoids in an edible or capsule. So you're wanting to take the cannabinoids you need and following it on a sheet 3 times a day. And then the flower is the other actually bigger medicinal component of the plant, are what they call the terpenes. And I don't know if you've heard of that.
I have, but very little. Please educate us.
Yeah, and it's interesting because it's almost coming full circle for me. When I first started my wellness center, I got into aromatherapy and certified in aromatherapy and essential oils. And they are very powerful in terms of healing. And that's exactly what the terpenes are. So I kind of had a little bit of a basis of understanding before I got into cannabis, but the terpenes are actually the 60 to 70% of the plant and are really where all the unique properties lie. So when you go to the dispensary and you see 18 different jars of bud, the THC is going to act the same way. So it really doesn't matter what you buy if that's what you're focusing on. Right. It's the terpene profile that gives it each unique property. And so I always encourage people to find their terpene, like almost like finding your, sign or, your skin, your skin type or whatever, your body type, and then use the strains of that terpene for that relief. And I have, I give this example. You really don't know what that smells like or does. Pineapple Express, maybe has some name recognition because of the movie. But, most things are labeled, or you can look it up on leafly.com. And this is a high carotene strain. So that is my terpene. Carotene is like a black pepper, great for gut issues, migraines, stress, immune system boost. And so that's what I do. I find carotene terpenes and try those and get closer and closer to remission or my healing. So it's a combination of cannabinoids and terpenes and I'm getting feedback from my patients, which is so exciting. That's where I learn from.
Well, and so is there on each one of these products, is there a breakdown of different percentages of ingredients that are in each one, or?
It's I wouldn't say as a percentage unless it's manufactured. So this is sort of a wax or concentrate, and this does have. It does say limonene 1.1 milligram, myrcene 6.7, and then it'll say the percentage of THC. But in flower, you're probably going to just get like a predominant, like terpene. A top terpene, middle note, and a bottom note. And then leafly.com. I always tell people, look it up on leafly.com. It's a great resource. And we'll usually, if the bud tender doesn't know or if it's not listed, then look it up on that kind of resource. And then you'll have a good understanding. Because I think what happens is Same thing just with the government, keeping it Schedule 1 doesn't allow any research to be done. So no one can see the benefits or the positive. They're just doing it on an individual scale, whereas everybody knows the negatives and everybody knows the harms because of whatever, this false media.
Well, yeah, and let's expand on that a little bit. So Schedule 1, the DEA, the Drug Enforcement Agency, still lists it as a Schedule 1,
Right.
which means marijuana is still illegal federally.
Right.
So no matter what the states say, and I'm all for states' rights, don't get me wrong, but no matter what the states say, federal government still said it's illegal. So like you say, there are still access issues because of that reason.
Yes, especially with research. If you can't do any research on a Schedule 1 medication, or they tell you there's no medical value, and then you're trying to convince someone that there is, that's tough. What I've learned is, what like Mark Twain saying, it's easier to fool people than to convince them they've been fooled. That's for sure.
Right.
It's so hard.
Isn't that true?
Yes.
Yeah. So, well, good. That's very enlightening. Thank you for that. So there's another thing that a big treatment area, one of your modalities is ketamine now, correct?
Yes. And we've been doing ketamine for, since we opened, in 17. But it was slower in the beginning, and then there was a shortage of ketamine. There was almost like a backlog. I don't know if you remember that, but I think it was right before Spravato came out. So I wondered if there was some kind of, sequestration by the drug companies or something. But and because I was focusing on wellness and people were coming in, just to maintain their wellness after, doing some work, I thought it was really good, especially for suicidal thinking, that dark places where you can't just get yourself out or biohack yourself out. But it wasn't kind of a focus until post-COVID, and that you just see people's, everything just collapsing. Mental health issues get much worse now. Financial struggles, relationship problems, and so I think people are struggling, and then they're searching. The same people who are searching for cannabis, that relief. I need something else that's going to help me with my mood, my pain, my stress, my sleep. Are the same people that could benefit from ketamine. So definitely want to just sort of get it out there, make it more open, vocal about it, that it is able, because it is accessible, because this too has a kind of a negative stigma, just like cannabis does, even though it's been safe used, since the 50s as an anesthetic agent.
Right.
And people say, oh, it's a horse tranquilizer, and it's actually preferred agent in children and animals, not because it's so powerful, but because it's good for people or animals that really can't communicate. Children, you can't really see or understand how they're feeling, and same with animals. So you just give them something safe, natural, that's not going to interact with anything, and it's going to go in and out, and then you're going to move on with your day. So when you don't know, ketamine is very safe in all. And then what they were finding is that low dose, and this was a study by the NIMH, low dose, or 0.5 milligram per kilogram. And I think in surgery, they're doing about 1.5 to 2 milligrams per kilogram. But anyway, low dose really is a shortcut to mental health improvement. The conventional pills, which kind of worked on the serotonin, dopamine, norepinephrine theory, are it's a race to the finish with glutamine theory, the new glutamine theory. And it's kind of a quicker way to heal depression, anxiety states. And that's what I've seen, just so life-changing results from people. And the NIMH came out with the protocol of 6 infusions in 2 weeks, or they had an alternate protocol, 6 infusions in 3 weeks, and found about 70 to 75% remission. When Spravato came out, recently, they also did a study with the FDA, and that's obviously industry, which is a lot different than NIMH studies, but they needed to do it, I think, weekly, but also showed about an 80% remission rate for depression symptoms. But the problem with the nasal spray is just ongoing. So, it's a maintenance. It's a chronic medication. Whereas with the infusions, it's sometimes it's remission, and we don't know how long that remission will last. Sometimes it's very variable, but it's gone. So I think that's a very exciting part too.
So can you expand on, you mentioned it just a little bit. Can you expand on the increase in, depression and suicides and stuff after COVID?
Yeah.
Have you been seeing that?
I definitely have. I've seen, the dark, depressing thoughts. I have not seen any completed suicide, increase in completed suicide, which is so good. But yes, the darkness, the lack of hope, even just the racial unrest, on all the political stuff that's going on now. Yeah, the morale of the world is low. And then just when you're on a micro level, there's just feels like there's a lot of darkness and depression. And then obviously we're going into the winter, which seasonal depression is, right at the peak right now too, or coming there. So this is just, almost like you say, it's a no-brainer. And maybe more ERs or crisis centers should really have the ketamine available, because it can just vanish those dark suicidal thinking.
So tell us the story. You had a story recently about a guy that went into a gun shop, then he found your office. Tell us that story.
Yes. This is where I knew that those dark thoughts is just, a thing of the past. I've heard those things in podcasts, and I really wondered, how does that work? Because even when you hospitalize someone, those thoughts don't go away. And so I was meeting this guy, maybe he's about 45, 50. Had a great, great businessman, successful businessman, but kind of lost everything, divorced, kind of that downward spiral. And then kind of moved to Missouri to be with family, was just kind of living off his brother, and just, at the end of it, was wanting to, very dark, went to the gun shop, was figuring out how to buy that, had to, wasn't successful the first time, but if he was, who knows what would have happened. And then talked to his brother about it. And then his sister-in-law was coming to Radiance for wellness treatments. And so got the ketamine infusion, and a different person after one infusion. And it was, Tuesday. By Friday, he was, pretty much to his baseline in terms of getting a job, going back with his business folks and getting ready to work, which is, even in my 15 years of psychiatric practice, you just get jaded. You're just like, there's no hope. That's not going to work. Right. And you're just like, what? I don't understand how this happened. And then, you give some placebo effects, or you're just like, oh, okay, this, but this has happened consistently. People we do what, like a rating scale assessment. And it's pretty comprehensive. They have maybe about 6 or 7 battery tests, and usually they're all, red or the red zone. And then after 6 infusions, they're like in the yellow or green, so mild or in remission. So that's just so exciting to see.
Yeah, what a great success story. So tell us a little bit about the protocol. It's probably patient variable, but how often do you have infusions?
Yeah, well, we do follow that NAMH protocol, just since we've had such great results. But at the same time, people are, like you said, it's patient specific, and there may be someone that doesn't need, there is a range, and so we want to sort of help everybody access it as well. But the real protocol that we see the best results with is 6 infusions within 2 weeks, and then the 7th infusion on the 3rd week, and then the 8th infusion on the 4th week. I think the 6 and 2 is the key. Some people have said, I feel great. I would like to hold off on my 7th infusion, a little bit longer until I need it. And I think those two I think that's fine. But so in 2 to 4 weeks, people are just a different person. And it's interesting. I've seen a lot of people, I think it's a common thread. I kind of talk about like a circuitous route. 1, 2, 3 infusion, 3rd infusion, we see like a downward dip in this, a nosedive in those rating scale scores. But then sometimes like in the 3rd and 4th, you can kind of go up, and some people say, oh, it's not, I feel worse. I don't know if it's working anymore. And they kind of start to panic. Maybe all that hope that they were experiencing, is kind of unraveling. But I always kind of say, whatever the path it will be 80% lower, at the end. So kind of ride with it, experience it, and then, stick with it. And that's what is also consistent. And I don't know how to explain that, but it just always gets better. And I think it's almost like filling up a bathtub. You just need a little bit more, a little bit more, a little bit more, and then it's like a masterpiece.
That's
like
a good analogy.
yeah.
So back on cannabinoids,
Mhm.
you had a story about a patient actually regulating their blood sugars with cannabinoids. Is that correct? Yeah,
Yes.
tell us about that story.
That is very interesting too. So, a diabetic patient, diabetic type 2, but then kind of reverted and had to be on insulin at the end, also, and was taking actually a CBD capsule. I call it Cannabis. Oops. And so it's kind of a hemp oil, full spectrum hemp oil, so you can get that anywhere. What does this have on it? 170 milligrams of CBD plus, cannabis flower and sublinguals, and was getting hypoglycemic episodes, and without changing anything of the insulin. Had an insulin pump and was just getting a hypoglycemic episode, and then so lowered his insulin, and then checked some parameters, and his glucose sensitivity was improving. A1C went down, insulin requirements way down, and just because of it added nothing else but cannabis, the CBD capsules, and cannabis products. So I think that is onto something. Also, in the terpene profile, I don't know if you can see this. Oops. There's the terpenes that work for diabetes are limonene and pinene. And so when you incorporate those two terpenes in your flower, and we also talk about THCV. THCV is a metabolite that does regulate blood sugar and can promote weight loss. So I think there's just a lot of confusions or myths with cannabis, the munchies, I'm going to get fat, but where there's, really ways to regulate and balance out things. I've heard so many people say they lost, 30 pounds, 40 pounds, some crazy amount just by kind of using cannabis, which regulates their body, balances out their body.
Well, and obviously it's as you've stated today, there's a different CBD profile, there's a different terpene profile. Mm-hmm. So it's important to work with somebody that knows what they're talking about when it comes to cannabinoids, correct?
Yes, I think so. And I think that is where the, if you just kind of wait till recreational, or you just go to recreational, you miss a lot of the medical nuances.
Well, I think with this stuff, becoming, legal in a lot of states, I think that's one of the things that we really need to happen is, doctors like yourself actually treating patients with it, so we can have some, more than just recreational experience with it.
Right.
That's really where the, the research needs to go, and is doctors like yourself actually controlling some of that. So I appreciate you, stepping up and doing that.
Yes, I agree. I wish we could do more, but I think our hands are tied. But yeah, it was going to be when the truth can come out with legal, with information, with data. It's going to be so great for everybody.
Yeah, for sure. So we're about ready to wrap up our podcast this morning. So, Dr. Thomas, how would you? What are their final words that you'd like to say in the last minute or so, and how can people get a hold of you?
Sure. Great. Well, thank you again so much for having me. And I think it's all about education. There's people are being fooled by so many propaganda, and there are natural ways to heal, or at least quick ways to heal. And we don't have to suffer that long. And so most with what I tell my patients is, there's so much craziness going on today, but we can improve our quality of life. And I have two powerful legal medications, at least in some states, to do that. And the ketamine infusions, I like to say, get to baseline with that. There's suicidal thinking, chronic pain, depression, PTSD, anxiety, OCD, addiction states. All of those can improve within 2 to 4 weeks, being a different person. And then maintaining your progress with the, nature's medicine, with cannabis, and just sort of keeping your body balanced at all times. You may never have to use those synthetics. So that's awesome. What I kind of like to kind of help people maintain their wellness.
How do people get a hold of you? How can people
Yeah.
find you?
Yes, perfect. I have, kind of two websites. So healthcitymmj.com is the cannabis website. Not only do we, are mainly in Missouri right now, but I am licensed in other states. So hopefully we'll have all the other states expanding for that. And then radiancestl.com. That is the ketamine clinic where we're kind of focusing more on treatments for mental health, but also have lots of other biohacking services like float therapy, infrared sauna, cryotherapy, a salt room. So, maintain and treat.
Awesome. I love it. Well, you've given out a wealth of knowledge to our listeners and viewers today. And of course, as always, I learned a lot on this podcast too. So
Oh,
thank you
great.
so much for being on our show today, Dr. Thomas. And
Thank
you've been
you.
listening. Yeah, you're welcome. You've been listening to Health Solutions with Shawn and Janet Needham. Tune in Monday, 1 to 2 p.m. As always, we will have a great guest and we will see you then. Thank you.
Yay.